Good morning, I'm Mike Maddock for Salina Regional's Morning Medical. Thanks for watching the show today. Today's program, we're going to be talking about some heart services at Salina Regional Health Center. With me, I have physician assistant Lance Kruger with the Salina Regional Health Center's Heart Center. Thanks for being on the show.
You're welcome. Thanks.
Let's start out telling the viewers some of the services offered at the Heart Center.
We perform coronary artery bypass, graft surgery, valve replacements. We also do thoracic surgery, lung surgery, and peripheral vascular surgery as well.
One particular reason why we wanted to have you on is to a new service that's being offered. I understand with those surgeries that you'd mentioned was the home visits.
Yes, sir. About 6 months ago, Dr. Toon said he read an article in a journal, and that's always a dangerous thing, because he said a group somewhere back east had started sending their mid-levels, nurse practitioners and PAs, out to patients' homes following heart surgery to see how patients are doing.
Okay.
And the reason was because they were having a lot of patients would be discharged from the hospital, went home, and 4, 5, 6 days later were having problems, whatever, breathing, whatever kind of problems, were being readmitted. They had a very high readmission rate, and that's one thing that insurance companies track as far as performance. So Dr. Toon said, well, this sounds like a good idea, why don't we do it? So Matt, the other PA, and I started doing it, and we go out and see our post-op heart surgery patients, valve and coronaries, and probably so far we've seen 20, 25 patients, and they just love it. The patients just love it. The biggest thing that I've discovered, and we have had a couple patients that we discovered a condition that they needed to come back to the office for. We took care of it in the office rather than having them come to the ER. So they weren't readmitted, the cost was minimal, and it was much more convenient for the patient. And in fact, this last Saturday, we met a lady in the office. Dr. Toon and I met a lady in the office on Saturday. We just saw her in the office because it was convenient. And so these things are picked up on home visits. And we sit and talk with the patients about their medication, ask them if they're comfortable with the medication, because they get so much information thrown at them.
Right.
So much medication, so much information that we just go through it all in their environment. You know, they're a lot more comfortable, and they just appreciate the time spent talking with them.
What time frame are we talking about?
We go the second day after discharge and the 5th day, so we go twice.
Okay.
But Matt and I mean, Toon would have us drive to Colorado if the patients were from Colorado. We said, look, if it's 50 or 60 miles, we'll go once, and then, so if they're 60 miles or more, we don't go. But if it's 50, 60, we'll go once, and other than that, we'll go twice.
Thanks for being on the show. Thank you for watching. For more information, please visit srhc.com, like us on Facebook, and follow us on Twitter for the latest news and updates.